best way possible and that you understand your child, okay? That's always going to be my number one reason, that if you can help understand your child and their strengths and what they're going to struggle with, then you're going to save yourself a lot of frustration. And when I say wrong, I mean, I didn't mean wrong. I mean, it would be a good idea to see a specialist to help guide you in the right direction, if that makes sense. Welcome to the Authentic SLP. My name is Nicole Yates. I've been a speech therapist for almost 20 years in the Tampa Bay area, and I'm here to help families and other speech therapists when they feel kind of stuck and not sure where to go. So, thank you. This is our second podcast, and I think for a second podcast, I thought it would be important to cover all the reasons why kids don't talk at 2, because this is our most common evaluation. And I know I had made some shorts earlier on social media about how it's really important. Like, if your kid's not talking at 2, there's probably something wrong. And that maybe came off offensive, and I do apologize for that. And when I say wrong, I mean, I didn't mean wrong. I mean, it would be a good idea to see a specialist to help guide you in the right direction, if that makes sense. And I know I didn't say the correct terminology. I know I was supposed to say kids with autism, children with autism, or children with Down syndrome. And I do apologize. Again, my goal is not to offend anybody, but I'm authentically me, and I say things wrong sometimes, and I just do that. So I do apologize. My hope is that I don't offend you. My hope that you guys all see that my heart is genuine and that I care about kids. But anyways, so most common question I get is, my kid is 2 and not talking. So let's go over some reasons and what are the potential concerns about not getting evaluated. So number one, I come in, the kid's not talking. They're super smart. All my kids are super smart, but they come in and like they can understand my directions. They're reading books with me, and they have this big hole in the middle of their teeth, and they're talking, but all I hear is like this really weird, like gargly sound. I don't understand anything they're saying, and they're very frustrated because no one can understand them. Does anybody know what's going on? That's right, pacifier and bottle. Number one reason, take out the pacifiers and bottles. They should not be used past 12 months. I think even the pediatricians are saying like 6 months for pacifiers. Don't quote me on that one. But definitely by 12 months, there should be no pacifiers in your child's mouth, and there should be no bottles. Get a straw cup. Those are the best things for your child to develop best like oral motor patterns, okay? If your child is talking with a pacifier in their mouth, just think about what that's doing. You are learning to speak in a very weird way. Like, your tongue is down, and also it changes the shape of your mouth. So if you let your child continue to do this, they're going to learn to keep their tongue down. It's going to affect their airway. They're not going to be good sleepers. Like, it can change the way their face looks. So please go ahead, and I know it's hard, but do that. Now, one reason kids use pacifiers to segue is because they have a blocked airway. So sometimes or suck their thumbs. That's another oral habit, but they will suck their thumbs or use a pacifier because their adenoids can be so enlarged, they're trying to open their airway up to breathe better. So before you just take it away from them, it would be a good idea to maybe check with an ENT to make sure they're not trying to open their airway so they can breathe better, especially at night, because that is a thing, and I do see it. So I send probably 60 to 70% of my evals to ENT. It affects if you have enlarged adenoids and tonsils or tonsils, or you need tubes in your ears. These are all huge reasons why kids aren't talking yet. If they can't hear right, they're not going to be able to say the sounds right. They're not going to be able to follow directions. If they can't breathe right, they're going to have behavior issues. They're going to have sleeping issues. They're going to have sensory issues. They're going to have feeding issues because it's going to be hard to swallow foods. And if your mouth is open all the time, your jaw is going to be weak. Your tongue's not going to be less coordinated and weak. Like, it's going to affect all the stuff for eating and speaking. So ENT, if you're on the fence if you should go to a speech eval, maybe you should see an ENT first, because that usually is a good place to start. So that's a huge one. And in that umbrella, kind of, there is tongue ties, and they do exist. And I think if your baby's that's not latching, you're getting a tongue tie, that's great. However, a lot of times kids do get tongue ties, and then they say they need more. No, if your speech therapist is saying, your dentist or whatever, saying they need another revision, like, let's stop. Try to go to a speech therapist that will try some other oral motor exercises and stretches, maybe a massage therapist, a body worker. Like, usually if you have a tongue tie and there's so much tension here, it might not be the tongue tie anymore. It might be that there's really tight muscles here. There's torticollis going on, right? It's all connected. So tongue ties have been very overdiagnosed recently, and I do believe they exist, and I think that you should get them surgically taken care of if you get the proper before and after training, and if your child actually does have a tongue tie, because it is overdiagnosed. And sometimes, like, you can't, if you have a tongue tie that's like attached, all the way there, like, there's no way to stretch it out, right? Because that's the thing. They're like, you can stretch the frenulum out. No, you can't do that, but you can stretch. Sometimes there is tight, like, just like this muscle could be tight and pulling it down. Like, if you feel that, there could be some tightness here or something here that needs to be worked out to release tension in your up here near the base of your tongue. So it doesn't necessarily mean that doing stretches is going to change this frenulum. You can't stretch that, but you can. There might be something else going on, like cheeks, lips, that we can work on as speech therapists, as OTs, as massage therapists, as chiropractors. There's a lot of things that we can get involved in instead of going right to cutting again. Because if you can cut, it's going to help mobility right away, but it might not. You're going to say, well, I'm going to need another revision. There's going to be more problems going down the road because you didn't fix the root of the issue. You just kept cutting. And yeah, so we'll have a discussion about that too. And I'm happy to direct people to great providers. And that's why speech therapy alone is never good. Like, usually there's other providers that need to be involved. So yeah, I mean, almost every eval I have recommendations of other providers, because it's usually not an isolated thing. Speech and language is usually not isolated. Usually there's a reason that this is happening, and our goal is to help you figure out what that is so that we can, figure out what the root is, so we know how to treat that child and understand that child the best we can. So there's that reason. Another reason is they could have like auditory processing disorder, ADHD, or autism. That does happen, and those kids are amazing. And if you get one of those kids, you will be super blessed. And I know I'm going to get some feedback for that, but all of those kids are amazing. All kids are amazing, and it's a different pathway for your child that you probably dreamed of at the beginning or you thought of, but there's a reason. And those kids all of them are so, I feel, connected to this world in a way that typical brains aren't. And I think we have so much to learn from them. So, I mean, that is a reason. And I can go over some of those signs with you guys in another episode if you guys have questions. Okay, this is where I shouldn't say anything, but I'm going to go ahead and say it. I'm going to have an expert come and talk about it. But I'm pretty sure when you know more than one language at one time, like, you're not delayed, but you might speak later, right? Bilingual people. If not, I'm going to have a professional on here to explain it. All I know is this. I know I'm right on this one. If you speak more than one language in your home, continue to speak more than one language. Like, never stop speaking your languages, ever. I can say that with confidence. Even if your child might be delayed, or if your child's not talking yet, don't stop one language. Especially, don't stop speaking the language that you're most comfortable with as a parent. Because the worst thing you can do is teach your child broken English. I've seen that happen. Also, some kids' personalities. That's true. Some kids are going to grow up to be engineers that don't really want to talk to people that much. They like their one or two friends, they like their snacks, and they like to figure out how to make my magnetic tower tall, and how to take apart a pin and put it back together. That's a thing. Yeah, personality. That can be a reason that your child isn't talking yet too. Yeah, so the reason I said, like, for an ENT, if you don't get it taken care of, what's going to happen? Well, they can change their face structure. And if their tongue is low, their jaw is weak, it can change the way their face develops and also cause your palate to be narrow. You might need a palate expander, and there's a certain age where you can't expand your palate anymore, and your tongue doesn't fit up there naturally where it's supposed to, and that can cause sensory issues and grounding issues. I don't know, but like for me, my palate up here is super narrow. Like I should have had a palate expander when I was a kid. I got out, my jaw is uneven. Now you guys have probably noticed it. My jaw is uneven. I think it all comes down for me was my core was weak when I was a kid, and we never worked on it. So I think, and then everything kind of compensated and grew, and so all of that stuff compounded to my speech issues and my intelligibility. That's why it's important. That's just like it can affect your child if you don't get those adenoids and tonsils taken care of. And it could be if you don't want to do like surgery, there are like things that you can do like Flonase, and there's some other non-surgical routes that you can take. Or if you are a person that's more into natural and home remedies, there's other things that you can do for that as well. Like I've seen both be successful, honestly. Every child is different. Every child responds differently to different things. I really don't judge any parent, and however they feel like is best for their kid. I trust you as their parent, but I'd like to give you the options that's out there so that you can make that decision for yourself, because if you don't even know about the options, how are you supposed to make them? So I would say those are the main reasons kids aren't talking when they come in. Yeah, there's reasons sometimes of like a medical issue like a seizure disorder or a genetic disorder, and that does happen. But I'm telling you the main reasons that I see. So yeah, if you're kind of on the fence of like, hey, my kid's not talking, they did have some ear infections, and their brother had their tonsils and adenoids out, maybe I should go check to me, and go ahead and do that. Ask the doctor for a referral. Usually if you have a history of a family member that has it, they're pretty cool about getting your adenoids x-rayed. You can see the kid's tonsils and you can kind of look at the fluid in their ears, but you cannot see their adenoids without an x-ray. So I always recommend that if you don't want to see an ENT, they can look at their tonsils and they can look at their ears. But if you don't want to see an ENT, ask your doctor if you can just get an x-ray for their adenoids, and then you can rule that out, and then you know that's not the issue. Please comment in the other speech therapists, what other things that you think are common reasons kids aren't talking. I wonder if anxiety would be on that one, because I also see that as a kind of up and coming more kids not talking because they're anxious or they've been through trauma. I also see that, and I see that being a bigger trend, unfortunately, through some of our populations. Yeah, I'd love to hear from you guys and what you've seen. And then again, if you guys have questions and concerns about your child, please sign up for a consult for like 15 minutes or an hour-long meeting that we can go over more in depth to your child's medical history. And again, I am not a medical expert. I am a speech therapist, but I can tell you as a speech therapist, I can refer out, and I can tell you who I would refer out to. I don't think speech and language is going to be the thing that will help your child the most. My goal is to help you help your child in the best way possible, and that you understand your child. Okay. That's always going to be my number one reason, that if you can help understand your child and their strengths and what they're going to struggle with, then you're going to save yourself a lot of frustration. Your child has something like auditory processing disorder or ADHD, no matter how many times you say that direction, they're not going to follow it at the age of 4. So let's figure out how to get you guys some services that helps you understand your child, so that you won't be frustrated with your child, and your child won't feel like they are misunderstood and they're trying so hard to please you, but they can't. That is the sad part, and that is what I'm trying to prevent. So thank you guys for listening. Have a great day, and I'm looking forward to just talking with more of you guys and learning more from you guys as professionals. Again, I am so excited at one of my core values is lifelong learning, and I can't wait to hear from other medical professionals and parents. I want to learn so I can be a better therapist and a better mom and just a better human. So hopefully my knowledge helps, but I know that I know so little compared to everybody else. So the more people we have on here, the better. So thank you and have a great day.